Is my voice clear?
Yes, ma'am.
Okay.
Am I audible, ma'am?
Yes.
Good evening to everyone for joining us today. On behalf of the Indian Association of Physiotherapists, Women's Cell Bihar branch, this Patna district East Zone, I warmly welcome all of you to this special webinar, The Insight into Sports Physiotherapy. I am Dr. Nidhi Rani, physiotherapist and sub-coordinator of Patna district East Zone. I am very delighted to be the moderator of this session. We are gathered here to explore the exciting world of sports physiotherapy, its evolving opportunities, and many more to go. Before proceeding, I would like to thank our leaders and mentors for their invaluable guidance throughout. Dr. Sanjeev Jha sir, Indian Association of Physiotherapists President, Dr. Ruchi Vasne Ma'am, National Head, Indian Association of Physiotherapists Women's Cell and Treasurer, Indian Association of Physiotherapists, Dr. Smita Singh Ma'am, IAP Women's Cell East Zonal Head, Dr. Joshni Pandey Ma'am, State Head, IAP Women's Cell Bihar Branch, Dr. Purnima Kumari Ma'am, Joint Coordinator Bihar Branch, IAP Women's Cell, and Dr. Swati Kumari Ma'am, District Coordinator, IAP Women's Cell, Patna District. Now, it's my honor to introduce our esteemed guest speaker for the evening, Dr. Richa Agarwal, ma'am. Ma'am is Associate Professor of Physiotherapy and Director Sports Physiotherapy at University of Patna. Mentoring professionals and shaping the field of sports physiotherapy. Her experience bridges the academic and clinical sport practice, enabling countless students to transition from classroom knowledge to practical real world exposure. A warm welcome to you, ma'am. During the next 25 to 30 minutes, ma'am will be sharing vital insights into the journey of sports physiotherapy from passion to a successful profession in the field. After the main talk, we will open up a Q&A session, giving you the chance for clarifying your doubts, requesting you all to write your questions in the chat box so we can proceed accordingly. Without any further ado, moving to our session, I invite Dr. Richa Agarwal, ma'am, to take the stage. Over to you, ma'am. Thank you very much.
Thank you so much, Dr. Nidhi. Good evening, everyone. Am I audible?
Yes, ma'am.
Okay. First of all, I am very much honored to thank you and the entire IIP Women's Cell and IIP team to give me this opportunity to come over the stage and deliver my experiences regarding the sports physiotherapy. I feel very much grateful to National Head Dr. Sanjeev Jha sir and Dr. Ruchi ma'am, National Head IIP Women's Cell and Treasurer, Zonal Head Dr. Smita ma'am, and other state heads and district heads of Bihar. I don't know much of their names, so I can't say more about them. But still, it's a very much privilege for me to stand here and give my best and my knowledge to you all. Thank you so much once again. So coming to the topic, first of all, I would like to tell you about what is sports physiotherapy? Insight into sports physiotherapy means a deep knowledge regarding sports physiotherapy. As we all know about physiotherapy, it's a treatment without medicine and with the help of exercises and different modalities we give to treat any patient. But when we talk about sports physiotherapy, it is quite different as we talk with the general physiotherapy. In general physiotherapy, we say that we treat patients, we treat them up to their daily routine. Like when we see a case, when we see a patient, when a patient comes to my OPD, I can say, then I assess the patient according, I ask his occupation, I ask his what he's doing, he or she is doing, and if a patient is a housewife or a sedentary lifestyle worker, like a job going person, we can say, who has a 6 to 8 hours sitting schedule, and he is complaining of back pain or a knee pain, then our first part of our as a physiotherapist is to assist that patient. But when we go for the treatment part, most of the time we do the treatment to make him or her up to the mark to his daily activities and the profession he or she is acquiring. But when we talk about sports physiotherapy, our treatment approach will be somewhat different than a normal individual. Likewise, when we talk about the treatment approaches, first of all, I just wanted to give you some highlights what we are going to take in this session. First of all, what is a sports physiotherapy? Its definition, scope, and importance in India growing sports industries. Then we talk about the career opportunities, common sports conditions, assessment techniques, and master's pathway, how to become a sports physiotherapist, and what will be the curriculum, and some of the major institutions. I must not say that if this is the top institution or this is the uh, this comes not under the top institution, but I can suggest some of the institutions which can give a good sports physiotherapy degree. So we are talking about a case. So for that thing, I must say that in sports physiotherapy, our treatment approach is somewhat different because we focus on the sports specific treatment to enhance the players or an athlete's uh, performance, sports performance. Moreover, it is sports physiotherapy is not like we a patient comes to us and we treat the patient. It is moreover a preventive therapy also. For that, we treat the patient. I can't say we treat the patient, but we as a physiotherapist, we teach the athlete how to prevent from injuries. For that, we have to give some pre-game or pre-injury protocols. For this, we call it as prehab. There's a there are two terms, prehab and rehab. Prehab means a protocol, a strength protocol or endurance protocol, or a given protocol to to prevent the injury part and to enhance an athlete's performance. And in rehab, when an athlete or an individual comes to us with a complaint, then we treat it. We call it as rehab. So these are the two different things. In a sports physiotherapy or with the help of sports physiotherapy, we we do a preventive approach for a athlete. Next thing, that difference. between the sports physiotherapy and the general physiotherapy is that for a general physiotherapy, we do some recovery protocols which are up to the mark, or which are like, we can say that I can give you another example also. For a person who is going to the gym for last 2 to 5 years, I can say, for deadlift, he can, if I'm talking about a male, he will put he will lift weight around 120 to 130 kgs for a deadlift. But if we talk about in case of a weightlifter, that 120 or 130 kg is nothing for the weightlifter. He can lift more than 200 kgs weight on a regular basis, because his training protocol is different, his daily routine is different, his daily workout is different as compared to the normal individual. So this is very much different. When we talk about the rehab protocol of an athlete, it is quite different with the normal individual. It is, we can call it as, it is an advanced recovery protocol which we advise a athlete. Okay, so this is the basic difference between sports physiotherapy and a general physiotherapy. We talk about the sports specific treatment, we talk about the performance enhancing approach, we talk about the preventive approach, and we talk about the advanced protocol, recovery protocols approach in case of a sports physiotherapy as compared to a normal physiotherapy. Now, coming to the scope of physiotherapy. This is just a difference between the sports physiotherapy and a general physiotherapy protocol. Now, coming to scope of physiotherapy. So, in scope of physiotherapy, there are again various things. First of all, the primary scope of sports physiotherapy is injury prevention. As we talk, when we work as a sports physiotherapist, we have to train the athlete according to his sports specific need, according to his game, how much training he or she needs regarding the enhancement of his or her performance in the game. Like if we talk about a cricket, and we have to train a bowler, so we have to focus on his shoulder mobility, his shoulder strength, shoulder muscular strength, scapular muscle strength, as compared to the back muscle, or as compared to lower limb muscles. Compared, I'm not saying that we do not focus on back muscle or the lower limb muscle. I just say that we have to focus more on the upper limb or shoulder or scapular muscles as compared to the back and lower limb muscles. But all the muscles are important because our whole body is a synergy. And being an athlete, the whole body works in a synergy pattern as compared to a general individual. As we talk about a sedentary lifestyle person, he or she may not require more upper limb strength for walking, but for a bowler, he or he needs more strength in his back and his lower limb also, as with respect to shoulder. But obviously, because he is a bowler, he needs more strength in shoulder, but as compared to a normal individual, he needs again more strength of his back and lower limb in comparison to a general population. Okay, second thing is injury assessment and diagnosis. As we all know that injury occurs at one point and pain may occur at another point also, which we call as referred pain or radiating pain. The injury occurs at some level and the pain radiates through a nerve course. So we have to see where the injury is with the proper assessment and diagnosis, and accordingly we have to manage that. I cannot say that this is not done in the normal physiotherapy, but with the sports, we have to be specific in that sport, and with that particular injury, we have to give the particular treatment to make the player or athlete ready for the next event or for the next game to his better level or up to the mark which he was before. Next thing is treatment and rehabilitation. When we talk about the prevention and assessment, then comes the rehab part. Obviously, rehab part is uh, equal to the assessment part. Where, in which case we give the assessment. If our assessment is good, then obviously our treatment will gonna benefit for the athlete. So these are all one with each other: injury prevention, injury assessment and diagnosis, and the treatment plan. Lastly, we talk about the performance enhancement, because for an athlete, he or she does not want to decrease his performance due to any injury. When, like we can say, I can share one experience with you. As I was posted for a tennis tournament, international tennis tournament, one athlete came to me with an ankle sprained ankle. So that sprained ankle is of second degree, but the pain of that athlete is too much because he had previous injuries too with on that ankle. But he was on his semi-finals. He won the semi-final and he was about to play the finals. But his condition was not that good that he can play for finals. But as a tennis player, he wants me to write that he can play. But in that case, I have to decide whether he is able to play or he is not able to play. For that, I did the assessment, and with that assessment, I recognized that the ATFL, medial ligament of ankle, the ATFL is almost torn. It is grade more than grade 2, almost torn. And if he will play, then it will tear. But still, for the sake of that tennis player, I give some treatment for 5 to 10 minutes and see if the pain subsides. But the player was not ready to stop. So at that time, sometimes it occurs that we can't help. At that time, we have to give some kind of treatment so that we can stabilize the athlete's ankle. And I did the taping at that time, stabilize the athlete's ankle, give some sprays, and after that, I tell him to give at least 6 to 8 hours of rest if it is possible. Then only we can decide whether he is able to play or not. By God's grace, he was able to play, and finally he won the match. So this is all we have to decide what we can do and what we cannot do for the performance, because for an athlete, his or her performance is the main aim in a game. So we have to decide various things. Then coming to career perspectives, in career perspectives we can say that just a moment. These are the career settings which We, as a sports physiotherapist, attain uh, various settings in hospital, clinics. We can get jobs in sports team. We can attach with the sports teams, and it is very good to attach with a sports team. Even nowadays, every state has its own team, own physiotherapist, and moreover, some of the players have their own physiotherapist too. Then we can do private practice. We can always open fitness centers for normal individuals and for athletes also. Then we have good opportunities in corporate wellness centers. And as an academician, we also do good in researches and in academic institutions. This is a general overview for career perspectives. Then we talk about the injury distribution. When we talk about sports injuries distribution, we talk about four types of sports. First of all, we have contact sports like boxing. So we have that contact sports. Then we have the overhead sports like badminton, bowling, tennis. These are the overhead sports. Then we talk about the running sports like marathons and sprinters, and then the jumping sports. All jumping sports like your basketball, volleyball. So we characterize sports into these four domains. For these four domains, there are different injury distribution. As a general, when we talk about injury distribution, then in most of the sports, most of the athletes, ankle sprains are most common in case of athletes or in case of sports. That is 25% of the sports. Then coming to the next, second most common injury is the knee injury. It can be a ligament injury, it can be a meniscal injury, it can be a tendinopathy, it can be anything. After that, we talk about the shoulder injuries. So, in shoulder injuries, there can be impingement syndrome due to overuse. There can be rotator cuff injuries again due to overuse. There can be dislocations. There can be tendinitis. There can be bursitis. So, all these injuries can occur on shoulder complex. Then, after this, we have low back pain, which is around 12% according to the data. So, this low back pain again can be of overuse, can be of less training of lower back muscles, and can be of some injury. Then after this, we have hamstring strains, which is again a good cause of any injury. Major I can't say, but it is quite common also in case of athletes. Then we have other injuries like groin injuries, other bursitis or tendinopathies, Achilles tendinitis, and after this we have tennis elbow, which is major common cause for tennis players. Then also we have golfer's elbow and other minor injuries we also can have. And one more thing I want to say that for contact sports, we have fractures, we have facial fractures, we have concussions in case of contact sports. In case of jumping sports, we have stress fractures. We have shin splints in case of runners, running sports. So these are the categories which I cannot say that only these injuries may occur in athletes. There are various injuries, n number of injuries which occur in athletes, but these are the main which occurs in the athletes. So in case of now, how we have to handle these injuries. Sports physiotherapists performing manual therapy. They have sports physiotherapists are actually the therapists which work manually. We on field, when we talk about on field during the game, we can't do any modality, we can't apply any modality on field. So we have to do everything manually. The only thing we can give on field is ice. Rest we have all have to do manually. So for that, manual therapy is a key for we sports physiotherapists. As a sports physiotherapist, we have to work mainly on the strength, endurance, and resilience of the sports and the which sports occupation of that athlete, whatever sports he or she is playing. For that, we also need resilience. For this, we have to do some assessments. Assessments, we can say some biomechanical assessments we have to do for the athlete to make his or her better diagnosis and to treat or to make a good protocol for his performance enhancements. For that, we do biomechanical assessments in the movement patterns, what type of movement he or she is having, what movement caused that injury, or where the athlete is lacking. In case of posture also, we have to assess the posture, which muscle is overworking and which muscle is weak, which is less working. For that reason also, the athlete can get injured, because if something somewhere if somewhere an athlete is having a tight muscle and on the other hand he is having a weak muscle, so that tightened muscle get more load at the event and it gets hurt again and again with that event, and that weak muscle will get again and again weakened because of not knowing the right thing, what is getting hurt and what is not getting active in the game. So we have to check those things also. For that, posture assessment is very much important in case of an athlete. Next thing is we have to give the proper clinical evaluations with the diagnostic techniques also. We have we should have medical collaborations for the diagnosis interpretations. For that we have to get good x-rays and good diagnosis by the orthopedicians, x-ray technicians or radiologists. We should have good communication between them. Then we have to see the specific injury assessment protocols. Like some injuries have their specific protocols with for example, in a ligament injury, we have to see what grade of tear it is, whether it is a first grade tear, second grade tear, or a third grade tear. Same with the case of the muscle injury. Then comes to our treatment part. When we are good in our diagnosis, obviously our treatment will be better, as I talked it earlier also. Then we talk about the clinical reasoning process. For this, we do step by step things in the on our part so that we can diagnose perfectly, and after that we can treat it according to that. Firstly, we have the clinical examination. For this clinical examination, we identify the symptom reproduction, range of motion, strength, power, endurance, and the activity tolerance findings. This process is necessary for, again, if we have good clinical skills, we check the where the injury is started, where the site of injury is, and for that, where the range of motion is going to hamper, at which level, what is the strength, what is the power, and what is the endurance and the activity tolerance of an athlete. Because some sports need strength, some sports need endurance, and some sports need power. So, according to the sport, we have to check all these things. Then, when we come through the examination part, we go how to plan the treatment. Then, when we plan the treatment, then we implement the treatment. Based on those initial findings, what we get with the clinical examination, the team collaboratively make an protocol, treatment protocol to improve the symptoms, range of motion, strength, power, endurance, and the activity tolerance. We call it as the cognitive intervention, where we see all the factors which is responsible for the performance of an athlete. After observing and assessing the effects of interventions and progress, we modify the treatment protocol. If we need, we have to modify. And if our treatment is going into the good direction, we have to again modify the intervention according to the athletic need. Like if a athlete needs more strength, then we focus on the strengthening protocols, which is going to be uh, progressive. Like we can say that if we start strength training with around, mm, we can say for an athlete, we can say with 20 to 25 kgs, then we have to increase the weight for the strengthening purpose. Then after that, we have to reinforce appropriate manual therapy and exercise treatment for the long-term process. We cannot say that we treat the patient according to the need. We obviously we treat the patient according to the need, but we cannot say that this is a 5-week protocol and you do this 5-week protocol and you will be absolutely right, because at the part of an athlete, he has to train himself on a daily basis, or we can say on a daily basis and for lifelong, till he or she is in the sport. Because when he or she stops training or stops rehabilitating himself or herself, or rehabilitating himself or herself, he or she will not be able to enhance his performance and achieve that goal which for which he is going to play. So for that reason, we have to reinforce and we have to tell the athlete to be in a rehab protocol for a long-term process. Then sports medicine team in action. As a sports physiotherapist, I cannot say that me as a sports physiotherapist is enough for a sports team. We have various uh, professionals also in the sports team or in a sports rehab team. Me myself as a sports therapist is not enough in a sports rehab team. There are many more medical professionals which comes under this sports medicine team, which we can say interdisciplinary team. So in interdisciplinary team, the process it's a cylindrical process. There are various medical professionals which come under this uh, interdisciplinary team. First of all, we can say that this team members, they are called as the core team members. So first of all, there is a sports medicine physician and a orthopedic surgeon. These doctors leads the medical team, diagnosing the injuries, creating treatment plans, and performing surgeries whenever necessary. They coordinate with other professionals to ensure that the athlete receives maximum and the comprehensive treatment with according to the need of the sport. Then comes the chiropractor. Chiropractor, which is responsible for maintaining the alignment of any body part, body bone, or any joint, who is who mainly focuses on the joint and spine adjustments. Then comes the physical therapist, or we can say sports therapist. Sports therapist for the rehabilitation of the of the athletes, who can make the athlete flexible, who works on the athlete's flexibility, its strength, injury prevention, injury rehabilitation, and strategies which are tailored for the uh, athlete according to his need of sport. Then comes the athletic trainer. Athletic trainer, which gives the immediate care in case when an physiotherapist is not available at certain point of time, or we can say when an athlete is doing training, at that point of time, if any injury happens, then athletic trainer will take care of it with, and he is also going to help with the conditioning programs of an athlete, which bridge the health management and the athlete to a wider area, so that conditioning protocol can can also enhance the endurance and the performance of the athlete. Then some collaborative modalities which also work nowadays in collaboration with the manual therapy, not on field but off field. If an athlete comes into your clinic or a rehab center or in hospital setup, then there are some collaborative modalities which also work. Likewise, shockwave therapy, which is going to stimulate the healing process of the injured tissues, which is going to help in reducing pain and improving circulation in chronic musculoskeletal conditions. Then there comes the orthobiologics like the PRP and the stem cells, which again has a advanced biological treatment like for the tissue regeneration. This PRP and stem cells, platelet plasma and stem cells, they help in the tissue regeneration and to accelerate the recovery of the athlete. Then comes this MLS laser and photobiomodulation. This is laser and photomyelin. This is non-invasive technique which reduces the inflammation at the injury site and also helps in the tissue repair at cellular level. So these things are also very much helpful in case of treatment purpose. So these are the interdisciplinary synergistic things which are helpful for which comes under a rehabilitation team, and they work for the betterment of an athlete to enhance, to improve his or her injury, to reduce its injury and increase the performance of the athlete. Now coming to career prospectors. For the career prospectors, I can say that first of all, as an individual, we have to go for a 4.5 years of bachelor's degree, which is going to be 5 years next from next year. Then there are various institutions and universities which are providing masters in sports therapy for 2 years, maybe 3 years in coming years. It is a specialized re program in masters, specialized field, as we have all other fields like orthopedics, neurology, and masters in cardiothoracic conditions, masters in geriatric conditions, community rehab, obs and gynae. So likewise, masters in sports physiotherapy is also an upcoming field which is nowadays making a boom in the students, like to become a good sports physiotherapist for the team or for an individual athlete. As we all, maybe we all know, we all aware, and you students are also aware of Dr. Ali Irani sir, who is the uh, main physiotherapist. He was physiotherapist for Indian cricket team long back ago, and nowadays he is retired from this cricket team. But he has worked at that time when very few of uh, people in India know about physiotherapy. At that time, he worked with Indian cricket team. So nowadays, many of the athletes are having their own physiotherapist. So after masters, you also can do various advanced techniques like manual therapy techniques, your this chiropractic, osteopathy, other taping techniques also for the your enhancement in the studies. And after this, you all can go in sports teams. Now, if we talk about the salary perspectives as a physiotherapist, so initially we can get around 2 to 5 lakhs per annum in the starting. But after, as we get experienced, or as you attached with any team or any good big setup, you can earn in number. I cannot quantify things, but you can earn a lot if you are a good sports physiotherapist. So your journey in sports physiotherapy will start here, that you can achieve anything with your hard work, with your dedication, and with your zeal to get knowledge from anywhere. And if you get knowledge, good knowledge, and you can be like, I must say that बिना तराशे तो हीरा भी नहीं बनता। ठीक है ना, जब तक सोने को आग में न तपाया जाए तब तक उसमें चमक नहीं आती। Like this, you all have to work hard for that to become a good physiotherapist and a good sports physiotherapist also. With these words, I can end up my session. I hope I had cleared all the points for insight in sports physiotherapy. Thank you. Any questions?
Thank you so much, ma'am. That was really very informative and detailed presentation on, I think, all the aspects of sports physiotherapy. Now let us move on the interactive segment. We will take questions from the audience now. And I request everyone to please type your questions in the chat box, and I will present them to our uh, speaker, ma'am, to one by one. Ma'am, there is a question. Ma'am, if we prepare for NET JRF from physical education, there's a huge syllabus of sports physiotherapy. How to approach for that?
Yeah, there is a huge syllabus for sports physiotherapy, I can say. But there are some basic things which you need to understand. And up to my knowledge, when you go for NET JRF, it is purely based on bachelor's level and somewhat master's level, but not specific to sports or anything. But if you talk about sports specific, then you can go to recent researches, and you can go basic sports books also for that, because nothing is I cannot say that everything is sports specific. There is basic things which they ask in case of any exam, sports specific also, but there are basic things. So you can refer Sports Maggie, Kareem Khan, and Zuluwaga. Those are the main books for sports physiotherapy. You can approach that, and you can go for recent advances in sports physiotherapy. There are various researches going on sports, so you can go through them. Okay, is it fine?
Yeah, ma'am. There's next question. In the field, if anyone got Bankart lesion or Hill-Sachs lesion during bowling or badminton, then what will be the first approach of sports physiotherapist?
See, when we talk about these lesions, these are the labral tears. So you first of all, what level we have to see, and if it is a Bankart lesion or a Hill-Sachs lesion, first of all, he has to go for the orthopedician to check it whether he or she is able to manage it conservatively, or that he has to go for the surgery. Because in those lesions, we cannot say that uh, we treat it conservatively only, and the athlete will go for the gain. We have to assess everything. Only we cannot say that if it is a Bankart lesion or a Hill-Sachs lesion, the athlete will not play. We have to check various things. We have to check how that lesion occurred, and what will be the previous history of that athlete also. We have to check each and everything.
Okay, ma'am. The
Okay.
next one. How do physiotherapists help athletes?
Uh, physiotherapist helps athletes in helping him preventing the injury, treating the injury, and enhancing the performance. This is what a physiotherapist can do. Because when
Yes, ma'am.
we talk about the athlete is not a, I can say, a general population. He has very much stress for the game. So as a physiotherapist, we also have to treat him psychologically regarding if he is having any injury. Then for that injury also we have the athlete will comes in stress. Sometimes they even depress if the injury is uh, little bit severe. That how can we play? My performance will be decreased. So for that, at that time also, as a physiotherapist, it's our responsibility to motivate the athlete and to help him by counseling him also. So we have various I can say things to do with the athlete. Rehab, injury prevention, treatment, then activity performance, it's game performance, and consoling him sometimes motivating him. Everything as a physiotherapist we have to do. I think I am clear
Moving
with
to the next one.
this.
Yes, ma'am. Moving to the next
Okay.
one, ma'am, I have a question about how can a physio can get qualified to work in any sports academy?
But there are different criterias for different academies. So it is all about the academy. Like for SAI, if I talk about the Sports Authority of India, they when they open their vacancies, they have their clear instructions that the person should be this much of age, having this much of qualification, and certain certificates they also need for that applying the post. So there are different academies have their different inclusion criterias, but MPT sports is the major criteria. If you are having a MPT sports degree, then you can apply for that. Some academies need some kind of experience, like on-field experience during your master's curriculum, or after your master's degree, you work with some team or some uh, local academies. They also prefer that. So it is different for different academies. Next.
Next is one, which condition we can use taping technique?
Uh, any tendinopathy, any ligament injury which is under control. My like I can say grade one tears in ligament or muscle tear, we can do taping. We have taping with two two different measures. One is for facilitating and another is of inhibiting technique. So it is we who decide whether we have to apply a facilitating taping or an inhibitory taping. Like sometimes we have uh, an injury, but we for injury in we can say in hamstring, but in hamstring there are four muscles. Which muscle is get more loaded and which muscle is less loaded? We have to give taping according to that. For like if we have to enhance the activity of of one muscle, we have to give a facilitated taping, and if we have to decrease the activity of another muscle, we have to give the inhibitory taping. So we can give taping in case of ligament injuries, in case of acute muscle injuries. Uh, we give taping in case of chondromalacia patella. We give taping in case of tendinitis like supraspinatus tendinitis, and we give taping to restrict the movement of one type and enhance the movement of another type. So I can say that when you are into the sport, when you are a sports physiotherapist, and if you are when you are into any sports academy or any sports with the team or with the athlete, then you have to decide things according to the need. I cannot say that this is a hard and fast rule, you have to give taping in this condition and you cannot give taping in this condition. But various times, many times you have to decide very intellectually, I can say, that where to use and where not to use. Because being a sports therapist, it's a very high responsibility of ours, as like we are game changers, we can say. We make an athlete to play and we make an athlete not to play at the time of game according to, so that, so we have to work, we have to act very smartly in that, at that times. It is not injury हुई, नहीं athlete नहीं खेल सकता, and we said no. We have to act very smartly. At times, when the athlete is at his finals, he expects us that we have to say, yes, you can go for play. So we have to think very smartly, we have to act very intellectually, how to deal at that scenario. So nothing is hard and fast that you have to do this in case of this and you cannot do this in case of this. I think I can clear your doubt, whoever is he or she.
Yeah, very well said, ma'am. Moving to the next one. Ma'am, after MPT, there are many diploma courses for sports physiotherapist. So after MPT, one should opt for it, or this MPT is sufficient.
No, as I told earlier also, MPT sports is a degree where you are taught a curriculum, like what are the sports conditions, how to treat them accordingly. But sometimes we need something which is beyond our curriculum. For that, we need some advanced diplomas. Like I previously told that nobody is going to teach you chiropractic and MPT sports. Nobody is going to teach you proper, a detailed assessment, I can say, because when we talk about the curriculum, na, it is time-bounded thing, and everywhere it is like we have to complete the syllabus. For that, we have to concise things sometimes, and we have to do our research work also at that period of time. So I cannot say that MPT sports degree is sufficient to be a good sports physiotherapist. But yes, it is a basic need to be into any sports part. And again, it depends what kind of advanced diploma you are going to apply. You have to think very smartly again that, okay, this is what I will be getting extra from my degree, or there are various diplomas which only teaches those things which you have read earlier in your BPDs and MPDs. So you have to choose which is more beneficial for you, and which is just because nowadays when we talk about this digital media, many things are coming, so we have to act again very smartly.
Right, ma'am. So, our next question is just in following with the last one, where it was about Bankart lesion and Hillside lesion. So, she's saying, according to my experience, I think the upper shoulder immobile with sling immediately just after the injury or pain, or if felt subluxation or dislocation.
Sorry, I didn't get you. Can you repeat
She's
the question?
writing, yes, ma'am, she
Yeah.
is writing, according to my experience, I think the upper shoulder immobile with sling immediately just after injury or pain or if felt subluxation or dislocation.
Okay. In which type you are
That
talking?
that one,
It,
the Bankart lesion or heel sach lesion during bowling or
that
badminton.
that I agree, but is she experienced this in sports or in a general population? Because in sports it is quite different, and in for a general population it is totally different thing. And what was her
Uh,
last question? It is like what we can do
Ma'am,
as a
last,
physiotherapist in case of
yes, ma'am, as
Bankart
first
lesion.
approach of physiotherapist. Okay, ma'am, she is asking about the general population who has
Yeah,
got
this is
lesion.
very much difference between the general population and the athlete. I all I previously also told that it is different. In sports person, okay, immobilization is okay, but I previously said that we as a sports rehab team, there is not only a physiotherapist. So, and moreover, immobilization is mainly done by the orthopedician or the medical practitioner, not by the physiotherapist. So this is different. Our approach as a physiotherapist is not to immobilize the shoulder in case of lesion. Our approach will be when the lesion get healed or get surgically treated, then we have to give the protocol or rehab part to enhance the athlete's performance or to get back into the game, or we can do before the lesion. Likewise, if the athlete got any injury previously, then accordingly we can treat him or rehab him to prevent those lesions. But at that point of time, it is not our duty, it is basically the medical practitioner's duty to immobilize that lesion, immobilize the shoulder. Even in case of general population also, when there will be a Bankart lesion or a Hill-Sachs lesion, the general individual, if we talk about the general population, the individual will directly go to the orthopedic surgeon. He will never come to us for the pain reduction only. Up to my experience, I had never see this thing that the patient of Bankart lesion or Hill-Sachs lesion directly comes to a physiotherapist for the initial treatment. So I must say that it is not our responsibility at that point of time to immobilize. It is the medical practitioner who is going to assess the level of lesion and to immobilize the athletic shoulder.
I hope it is clear now. Moving to our last question. Good
Okay.
evening, ma'am. I would like to know what all new intervention we have to treat ACL injury patient.
There are various interventions. Like if are you talking about ACL reconstruction, rehab protocol after ACL reconstruction, or just a conservative treatment? And see again, when we talk about an athlete with ACL injury, okay, whether it is a grade 2 or grade 3, every athlete is different. Like we can say every individual is different, every injury is different, every condition is different. At that point of time, I must say that every individual with an ACL tear is also different. It depends what is his previous condition, grade 2 injury. So grade 2 conservative treatment, grade 2 injury, first of all, I could say never goes for a conservative treatment, because it's an athlete, he or she has to go for ACL reconstruction. It can't be treated conservatively in case of an athlete. Okay, so I think first thing I had clear to you. Next, on the like you said, the
I think there is some network issue. I think there is some network issue from ma'am's side. Till then, if there is any more query, you can write it down, or after that we'll move to in the session.
am I audible?
Yes, ma'am.
Okay. So I was telling about that ACL reconstruction, ACL injury. So again, it
Yes,
depends on the patient's condition, on the athlete's condition. It is different for all. How much pain he is having, and what range he is having. It all depends. So accordingly, we have to give interventions. We have to manage things. We cannot say that this is the protocol for this is a general intervention for the all athletes, all ACL injury athletes. Okay. Any other question?
that's it for now. So I hope it has been a very interactive session for all. So moving to the end, as we approach to the end of this enriching webinar, I would like to thank Dr. Richa Agarwal ma'am for her wonderful session and to all of our dignitaries and organizing team for their support. Thank you to all the participants for your engaging questions and active participation. If you wish to explore more or have any further queries, feel free to connect with us after the session. Till then, stay inspired, keep learning, and let us all commit to advancing the field of physiotherapy. Thank you. Thanks a lot.
Thank you so much, Dr. Nidhi. Thank you so much, the whole IAP team, for giving me this opportunity. Thank you. Good night.
Thank you so much, ma'am. Good night.
Okay.